Hi, I'm David Klein. I'm an orthopedic surgeon at Kennedy White Orthopaedics in Sarasota, Florida. In this orthopedic moment, I wanted to talk to you about the rotator cuff muscles of the shoulder and their function. The rotator cuff is a series of muscles that originate on the shoulder blade, both on the front and the back, and they surround the ball and socket part of the joint. There are four muscles involved: the subscapularis in the front, the supraspinatus on top, the infraspinatus behind the supraspinatus, and the teres minor in the low part of the back of the shoulder. The rotator cuff has two functions at the ball and socket joint. The most important is that it keeps the ball centered in the socket, so when the deltoid muscle, which comes from the collarbone or clavicle here and goes down to the edge of the humerus at mid-humerus, tries to lift the arm up, it keeps the ball in place so the ball doesn't shift upwards. The rotator cuff centers the ball in the socket. The other thing the rotator cuff does, especially as it reaches across in the front and the back, is it provides rotation of the humerus. So you can externally rotate, which allows you to reach higher overhead, or internally rotate, which often allows you to do things such as reach behind your back or reach onto your belly. These are the two functions of the rotator cuff. The rotator cuff is in a difficult place in the body because it literally lies between two bones. The top of the shoulder is called the acromion. That's the process of the shoulder blade that forms the roof of the shoulder, and underneath is the ball part of the humerus. The rotator cuff can be pinched in between these two as you raise your arm up and down. This is what typically leads to rotator cuff problems that can include tendinitis, partial thickness rotator cuff tears, or full thickness rotator cuff tears. If you have rotator cuff problems, typically your pain is not at your shoulder, but it's actually felt along the outside of your mid-arm. Things like reaching to the back seat of a car, tucking your pants in, for women fastening a bra. These are things that often cause pain. It's very often positional pain, and there's not much motion loss from having rotator cuff problems, especially with your arm down at your side. If you're having problems with your arm like this, I would advise you to see your orthopedic surgeon to be evaluated to see if you have a problem with your rotator cuff and discuss various treatment options, which could include medications, therapy, possible corticosteroid injections, and more rarely, surgery. Thank you for listening to this orthopedic moment about the rotator cuff.